And we're back with the power of movie magic, because I was well prepared before I started this movie. I have a mink or cat leg. I'm going to constantly say mink because that's what we did for years, or I did for a year. But this is what you want to do. You want to get most of this muscle off, and see how I left a little bit for the patellar ligament. So now I'm going to do that little flexion. So all these quadriceps constrict or contract, and that extends your knee. So that's what that does. So it just kind of kicks a soccer ball a little bit. Right here, that's your tibial artery and vein. So that's that artery and vein that you have to watch out if you ever tear your ACL or PCL, so you don't sever that. And then when you get it all cleaned up, be careful for your tibia and fibula, because your fibula on the cat is pretty thin, so you don't really want to cut that because it can get cut by scissors. And then if you look, the leg does twist a little bit. You can see some separation from the tibia and fibula, and they are not fused like the cow and horses are. They have what's called the cranial and caudal tibiofibular ligament, and that basically acts like your tibia and fibula, and then it attaches like that, so it kind of keeps them from rotating separately off each other. And then what happens there, when you tear one of those ligaments, you can get a high ankle sprain. So that's what that is, that tear of the tibiofibular ligament. And then when you kind of see that, perform what's called the anterior jaw test. And when we say we don't use the anterior portion, anterior terminology when you talk about animals, it's because it's just adopted from the human medicine. So what they do is they'll secure your femur or your thigh, and then they'll move the distal portion of your leg, so your tibia and fibula. So you see there's not much movement at all. That's because your caudal and cranial cruciate ligaments, they kind of cruciate because they cross. Remember from a lecture before, and so they stabilize that knee. And then you can see what happens if you twist your knee too. And so what's on the side here is your collateral, so your medial collateral and your lateral collateral. And a good reference mark is, sometimes people forget if this is a right leg or a left leg. You look at where your fibula is. So the fibula is going to be the smaller of the two bones, and the fibula is always going to be on the lateral side of the animal. So since this is on the lateral side, this is a left leg. So you can see how that is. So this would be obviously the lateral collateral, and this would be the medial collateral. So now what you want to do is slowly pull up on your patellar ligament and tendon, and then you'll see a little bit of connective tissue, and that's what's called the joint capsule or the stifle capsule. So what you want to do is just gently cut that away, and just kind of be patient a little bit. You don't want to work too fast and rip any of your collateral. So you see that just kind of go. So I just broke part of that joint capsule. So you just want to follow this on this little condyles part of your knee. And you can see that it opens up just like that. So I'm just going to pull it open with my hands. So that is what inside of the knee. So this would be the femur, and this little bone here is the patella, which is the cutest of all bones, because obviously it is the cutest of bone. That's the reason why. And then you see all this, let me try to push it with the camera. So all this yellowish substance, that's what your meniscus is. So basically it's that cushion between your femur and tibia and fibula on your joint, so it's not bone-to-bone contact all the time. And you have a fluid in here that makes it really slippery, so your joints don't creak and all the time. Some people's do, like mine need to always creak and curl. So if you try to separate that up, and just be careful not to go too medial or lateral, so you cut the collaterals. But you just want to do it right at the distal end of where the patella is. And then you kind of open up, and then you can see right next to this artery is the cranial cruciate, or the in people it would be called the ACL or anterior cruciate ligament. So that is there. So what the cranial cruciate, it basically stops your tibia and fibula from moving cranially. So that way would be cranially, see it doesn't move at all. And what you want to do is you want to hyperflex your knee and take your scapula and just carefully cut your cranial cruciate. I didn't cut it all the way. Now I cut it. So they're going to do the anterior drawer test again. So if you can see that knee, it doesn't have a whole lot of movement, but hopefully you can see it in the camera, and this thing is getting slippery. You see there's a slight movement. Maybe I can make it a little more dramatic by hyperflexing it a little bit. So that's what that movement is. So when the tibia and fibula move cranially, that's the cranial cruciate is damaged. So if you're in a doctor and they're trying to figure out if your ACL broke, they'll take your shin, and if they move it away from you, that would be the ACL that broke. Likewise, if you broke your PCL, so sometimes the easiest way is to hyperextend. So we're going to try to hyperextend this knee. There it goes. So now we have really dramatic movement. It wasn't a good snap like some of them are, but that sometimes will sound like a bone breaking. So now you see the tibia and fibula moving backwards. Some people with knee issues, this is a hard lap to do because it just kind of reminds them of so much pain that they had once experienced. Thankfully, I've never have, so it doesn't bother me too bad. So that's what that is. So when the fibula and tibia, excuse me, I'm saying it the wrong way. The tibia and fibula move caudally. That you can tell is the caudal cruciate that broke. And then you can still see that we still have the same amount of twist motion because our lateral collateral and medial collateral wasn't affected at all. One thing I really want to show you real quick is when you do hyperflex, you do have the chance of breaking it right at the growth plate. So this is my practice one. This is not as cleaned up. You can see that the distal head, or the proximal head of the tibia, is still in the knee joint. So that's your growth plate. Also, it's kind of neat of this animal, and these are the same bones. You can see that there's a big difference between its left and right leg on its femur. You can see, and my guess, and I think I'm pretty close and accurate, I confirmed with Dr. Rosell, is that this cat broke its femur and it never was set again. So that's why you have this little bit of a twist in, and then you have this overgrowth in the bone. So it's kind of watch out for that. Hopefully you'll have healthy cats that came through instead of this kind of oblong. But that's kind of neat. I'll show you guys this in class. And if you also, and backed up to this guy, if you can hyperflex it, what you can do is take your scalpel and just cut farther in through the meniscus and through all these ligaments. Just be careful not to cut in your collaterals, and it'll still do your accomplished anterior drawer test. So you got quite a bit of movement now. That's it for the mink cat stifle joint. Thank you.